Minister for State, Health and Family Welfare, Shri Abhay Thakur, India's G20 Presidency, Su Sherpa, Additional Secretary, Ministry of External Affairs, Shri Sudhansh Pant, Secretary Health, Government of India, Honorable Ministers of the Troika from Indonesia and Brazil, Honorable Ministers of the G20 members and invited countries, and distinguished delegates. A very good morning to you all. On behalf of Government of India, it gives me immense pleasure to welcome all of you to the state of Gujarat, situated on the India's western coast, known for its vibrant art, architecture, culture, heritage, and traditions. With amalgamation of modernization, Gujarat is an embodiment of multiculturalism. Handicrafts of Gujarat are famous not just in India, but across the world, as the artisans of Gujarat create the most intricate and colorful handicraft products. Gujarat, one of the most attractive tourist destinations in India, is famous for UNESCO heritage sites, religious places, Asiatic lions, the Great White Desert, Rann of Kutch, and so much more. Gandhinagar, as the name suggests, honors the memory of Mahatma Gandhi and India's fight for independence. Gandhinagar is the home to Statue of Unity, world's tallest statue, 597 feet high, and world's largest exotic aviary geodesic dome with 500 birds belonging to 30 species. Excellencies, I hope you get an opportunity to experience the enriching energy, culture, and amiability of both Gandhinagar and Gujarat as a whole during the next few days. Excellencies, as profoundly encapsulated in the theme of India's G20 presidency, One Earth, One Family, One Future, the world needs a unified, inclusive leadership to resolve the challenges that we collectively face without being limited to geographical boundaries. COVID-19 highlighted the need for strengthening the health systems and underscored the need to treat every global citizen as equal. Over the 4 health working group meetings, we had extensive discussions on India's G20 health priorities and deliberated how collectively we as G20 countries should not let the phenomena of pandemic fatigue diminish the momentum built during the pandemic. The next 2 days will facilitate the honorable ministers from G20 countries for converting the culmination of the discussion into substantial and actionable deliverables so as to create a healthy future. Excellencies, with these words, I once again welcome you all to the G20 Health Ministers meeting, and I would like to inform distinguished delegates that for the benefit of colleagues who are not able to join the meeting from this hall, we have organized an overflow room which is being organized in the CEO's boardroom on the first floor to accommodate the distinguished delegates in addition to the permitted number of delegates in the meeting hall and with signages provided to guide you. Excellencies, Sanskrit is the oldest living language of the world. The name Sanskrit means complete and perfect. Among the currently recognized ancient languages, Sanskrit is one language which has retained its purity. The oldest literature of the world, the Vedas, the Puranas, and the Itihasas are still available in the same form that they were written in at the very beginning. As we proceed further today, let us invoke blessings from the Almighty through a Sanskrit shloka or a couplet with 16 syllables for a healthier future, for which I invite participants from Sri Somnath Sanskrit University to take the floor. Sri Somnath University focuses on preserving the enriching legacy of Sanskrit in all aspects of learning. The English translation for the shlokas will also be projected on the screen to guide the distinguished delegates.
काले काले महामारी काल रूप जायते केवलं मानवानां न जीवानां जायते क्षतिः कोरोना कालसन्तप्तं विश्वं जातं विकम्पितं विमुक्ता बन्धनं प्राप्ता भीतिं प्राप्ता सभित्तिकाः विद्यार्थिनां हतोऽभ्यासो व्यापारोऽपि दिवङ्गतः विनष्टाशा जना विश्वे हन्तुमात्मानमुद्यताः अन्धकारो जगद्व्याप्तः कोरोना कालनिर्गतः शून्यदिग्दर्शनं दृष्ट्वा विश्वं जातमचेतनम् देवायता पुरा काले सम्मिल्य सरितां पतिम् मथित्वा मूल्यरत्नानि सुधां चैव प्रपेदिरे मत्पातं देवायथा पुरा काले सम्मिल्य सरितां पतिम् मथित्वा मूल्यरत्नानि सुधां चैव प्रपेदिरे वैद्यैर्यथा तथा वैद्यै देवायथा पुरा काले सम्मिल्य सरितां पतिम् मथित्वा मूल्यरत्नानि सुधां चैव प्रपेदिरे तथा विश्वमेकनीडं मन्यमाना चिकित्सकाः महामारी विनाशाय प्रापुर्वैक्सीनमायुधम् वैद्यै विहितो विधिवक्षमः सेवाभावेन संयुज्यम् आनेतुं न धनेप्सया
संगच्छध्वं संवदध्वं
सम्भो मनांसि जानताम् एषा वैदिकी वार्ता जगत्कल्याणसारिणी ॐ शान्ति शान्ति शान्तिः
Thank you, distinguished scholars from Somnath Sanskrit University, for your blessings and invocations. Excellencies, now we look forward for an anamorphic 4D showcasing a storyline depicting the earth and its symbolic and symbiotic relationship with humans. The storyline conveys the need for collaboration with a message to converge, consolidate, and create a healthier tomorrow.
In our pursuit for good health, let us recognize that our planet's health and our own health are inseparable. As we are faced with the consequences of our own actions, the world is constantly prone to a myriad of health challenges. By converging health emergency initiatives, knowledge, and resources, consolidating existing efforts towards health systems strengthening, we pave the way towards creating a healthier tomorrow. efforts in silence inevitably fell short, subsequently resulting in an unprecedented health emergency. We may have contained the present health emergency, but the challenge still remains. Three out of 4 people in high-income countries, but 1 out of 3 people in low-income countries are vaccinated with at least 1 dose as on 9th August 2023. It is time to come together as a unified force to converge, consolidate, and create a healthier tomorrow for one and all.
Excellencies, a powerful message highlighting the spirit of hope and linked with our collective efforts towards a healthier tomorrow. I would now like to request Shri Sudhansh Pant, Secretary for the Ministry of Health and Family Welfare, Government of India, for his welcome remarks. Sir, the floor is yours, please.
Namaskar, good morning, welcome. Excellency, Honorable Minister for Health and Family Welfare, Chemicals and Fertilizers, Government of India, Dr. Mansukh Bhai Mandviya ji, Excellency, Dr. Tedros, DG of WHO, Excellency, Mr. Katsunobu Kato, Honorable Health Minister, Japan, Excellencies, Honorable Ministers of State for the Ministry of Health and Family Welfare, Professor S.P. Singh Baghel and Dr. Bharti Praveen Pawarji, our Additional Secretary and Sue Sherpa from India, Shri Abhay Thakurji, colleague in the Ministry of Health, Shri Love Agarwalji, Honorable Ministers of the Troika from Indonesia and Brazil, Honorable Ministers of the G20 countries, the deputies, and ministers from the invited countries, distinguished delegates, officials from all ministries, colleagues, ladies and gentlemen. At the outset, I would like to welcome all of you for this ministerial meeting in Gandhinagar, Gujarat, during India's G20 presidency. Over the past 3 years, the world has witnessed the devastating impact of the COVID-19 pandemic, which has affected hundreds of millions around the world. While the pandemic has officially been declared to be over, the COVID-19 fatigue should not be the reason leading to the cycle of neglect. We must improve our ability to prevent, prepare, and respond to health emergencies and strengthen international cooperation for a coordinated strategy to ensure the safety and well-being of all our citizens. It is also crucial to ensure equitable access to safe, quality, effective, and affordable medical countermeasures for everyone. We must address the disparities in health access and create an environment where medical countermeasures are available and affordable to all nations regardless of their economic capacities. In this era of technological advancement, digital innovations and solutions have revolutionized the healthcare delivery and improved the patient outcomes. We can enhance service delivery, the quality and efficiency by harnessing the power of data, artificial intelligence, and machine learning, and through solutions like telemedicine. These three health priorities are inherently interlinked and mutually reinforcing. In addition to these three priorities, India has hosted 13 co-branded events that discussed various health challenges in the run-up to this ministerial meeting during the year of the presidency of the G20. Excellencies, on the sidelines of the health ministers meeting, we are also hosting the WHO Traditional Medicine Global Summit, the One Earth, One Health Advantage Healthcare India Summit, and the Sustain, Accelerate, and Innovate to End TB in the Southeast Asia region, a WHO Southeast Asia region TB event, along with the Indian MedTech Expo as co-branded events, which were inaugurated yesterday. Furthermore, we have curated exhibitions spread over 100,000 square feet, covering the health sector, including medical technologies and devices. We look forward to the guided tours to these exhibitions by the excellencies who are visiting from all the countries. Together, we need to converge, consolidate, and create a healthier tomorrow. Thank you. Jai Hind.
Thank you, sir, for your welcome remarks. Excellencies and distinguished delegates, today we are also joined by His Excellency Mr. Kasnu Nobu Kato, Honorable Health Minister, and also G7 Presidency for the inaugural session. I would like to request Excellency Honorable Health Minister Japan and G7 Presidency for delivering the keynote address. Excellency, you may have the floor, please.
Thank you, Indian President and Minister Mandavir. I would like to pay my respect for all your effort and great leadership in facilitating the important agenda in global health. I also would like to express my sincere appreciation for all the endeavor and warm hospitality of the Government of India, Gujarat State, and the Gandhinagar district upon holding this meeting. Despite the busy schedule, thank you, Minister Mandavia, for joining the G7 Health Ministers meeting in Nagasaki in May and the Japanese presidency. I'm grateful to be invited to your hometown, Gujarat, for the G20 Health Ministers meeting and looking forward to discussing with G20 colleagues. Furthermore, I'm very honored to have the opportunity for an intervention at the inaugural session. I'd like to share a few points from the perspectives of synergy in G20 and G7. 3 years have passed since the outbreak of the COVID-19, and there has been a growing interest in the health sector. During this period, there were progresses in international cooperation, including the sharing of information in a timely manner, supporting the medical and health systems, and developing the medical countermeasures. It's needed to build resilient health systems from peacetime, as well as contributing to the pandemics based on the lesson from the COVID-19 pandemic. Based on this situation, we have set 3 main agendas under the theme as working together for a healthier future. The 3 agendas are strengthening global health architecture for public health emergencies, contributing to achieving more resilient, equitable, and sustainable universal health coverage, and promoting the health innovation. And we discussed this with G7 members and outreach countries, India, Indonesia, and Vietnam. This year's G20 agenda has strongly synergies with the ones in the G7, and we see this as an opportunity to further develop the discussions at the G7. In addition, this year marks a milestone that UN General Assembly high-level meeting on pandemic PPR, UHC, and TB will be held next month, while discussion on amendments to the International Health Regulation and WHO take place in the WHO. It's important to enhance the political momentum through G20 and G7 and move toward leader-level discussions. Now, I would like to share the outcome of the G7. First, regarding UHC, Japan achieved the UHC early by establishing universal health insurance system in 1961. We have been leading the discussions and cooperating globally based on our experience. At the G7 this year, we talked about action that should be taken as the G7 toward achievement of UHC across the world, while recovering from various health issues set back by the pandemic. These actions were arranged under action areas and compiled as Global Plan for UHC Action Agenda as an annex to the Health Ministers' Communique, along with the UHC Action Agenda by UHC 2030. Furthermore, it was emphasized to note the importance of global hub function, including the financing, knowledge management, and human resources on UHC, not only during the pandemic, but also at peacetime. Second, on MCMs at the G7 summit, the G7 Hiroshima vision for equitable access to the medical countermeasures was released, and based on the principles in the vision, MCM Delivery Partnership for Equitable Access, MCDP, was launched as one of the concrete efforts to promote equitable access and delivery of MCMs. Third, on AMR, for the first time in the G7, the importance of implementing pull incentives were recognized, as well as push incentives to facilitate research and development of new antimicrobials. In Japan, we are starting a new project on pull incentive this year, in addition to continuing the push incentive effort. We are also planning to hold the G7 high-level technical meeting on One Health in the later half of this year with participation from ministers of health, agriculture, and environment. Next, regarding collaboration between finance and health ministers, G20 Joint Finance and Health Minister meeting was first held in 2019 under the Japanese presidency. In light of importance of financing is promoting UHC. We held the G7 Joint Finance and Health Ministers meeting, and we emphasized further strengthening finance-health coordination and the necessity to consider the pandemic response financing, including surge financing. Lastly, in order for working together for a healthier future for people across the world, it's important to enhance collaboration among the G20 members and effort in each G20 and G7. I hope the next year's presidencies, Brazil in G20 and Italy in G7, would build up the outcomes of this year to the next year and beyond. Japan will continue to contribute, work together. Thank you very much.
Thank you, His Excellency. Thanks for highlighting the ongoing convergence between G7 and G20 platforms and acknowledging the deliberation of health priorities in India's G20 presidency. Colleagues, we're also joined here by His Excellency Dr. Tedros, DG WHO. I would now like to request Dr. Tedros to deliver his keynote address. Sir, the floor is yours, please.
Thank you, our moderator, Love Agarwal. Thank you so much for your leadership and hard work during all this process. Your Excellency, Minister Chiri Masuk Mandavia, Your Excellency Minister Kato, Excellencies, colleagues and friends, Namaste. I thank India for its generous hospitality and for its visionary leadership by making health a priority of its G20 presidency. I also congratulate India for its commitment to universal health coverage at home, especially through Ayushman Bharat, the world's largest health insurance scheme. On Wednesday, I had the opportunity to visit a health and wellness center here in Gujarat, which is providing primary care services to 1,000 households. I was especially impressed by the use of telemedicine to provide consultations with prescriptions provided online and medicines distributed locally. This is just one example of how digital technologies are transforming health locally and globally. I thank India and all G20 countries for your leadership in developing the global initiative on digital health, which will launch formally tomorrow. This important initiative will support the WHO global strategy on digital health and amplify other initiatives, including the WHO Global Digital Health Certification Network, which we re-established earlier this year with the support of the European Commission. And my appreciation, we want to use this opportunity to thank the European Commission. Digital technologies have proven potential for delivering health services to marginalized groups, for improving quality of care, and for detecting, preparing for, preventing, and responding to health emergencies such as COVID-19. Although COVID-19 is no longer a global health emergency, it remains a global health threat. Just yesterday, WHO classified a new variant with a large number of mutations, BA2.86, as a variant under monitoring, highlighting once again the need for all countries to maintain surveillance. This is also why we're continuing the ACT Accelerator and why we continue to seek the support of G20 countries for it. COVID-19 has taught us all an important lesson, that when health is at risk, everything is at risk. There are encouraging signs that the world is learning the painful lessons of the pandemic, beginning with the presidency of Saudi Arabia. A relay of discussions led to the establishment of the Joint Finance Health Task Force under the Italian presidency, supported by Indonesia, and now India under their respective presidencies. As you know, negotiations on a pandemic accord and amendments to the international health regulations are making good progress. Both processes are essential for creating the legal and operational framework for an inclusive, coherent, and equitable global health security architecture. In tandem, WHO is leading or supporting several initiatives to strengthen health emergency preparedness and response, including the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, the WHO BioHub System, the Global Health Emergency Corps, and the Universal Health and Preparedness Review. Building on the lessons learned from the success and shortcomings of the ACT Accelerator and other processes, including the G20 and the Johannesburg process, WHO has developed a concept note for an interim mechanism to coordinate timely and equitable access to medical countermeasures for epidemic and pandemic threats. We welcome the constructive discussions that G20 countries have held here in Gandhinagar and thank India for its leadership on this. We encourage you to work with non-G20 countries to build and broaden consensus, and we look forward to establishing the interim mechanism at the earliest opportunity. Let me leave you with 4 requests. First, I seek your commitment for the implementation of the global initiative on digital health. Second, I seek your commitment to inclusive and consultative dialogue with all member states on the interim mechanism for medical countermeasures. Third, I seek your continued support for the Joint Finance Health Task Force to complete its work on surge financing and economic vulnerabilities to pandemics, and to continue the collaboration to address other challenges. And fourth, I seek your commitment to negotiating a comprehensive pandemic accord that encompasses all the lessons of the pandemic so that we never repeat the same mistakes again. Time is the essence, and with the accord scheduled to be considered by the World Health Assembly next year. My thanks again to India, to Prime Minister Modi, and also to Minister Mandavia for their leadership, and to all of you for your leadership for a healthier, safer, fairer world. I thank you. And back to you, Lam.
Thank you, His Excellency Dr. Tedros, for highlighting that time is of essence and the fact that there are certain concrete deliverables which we should focus on in the times to come when it comes to a strengthened health system, and we remain prepared to manage any future health emergencies. Thank you, sir. We take note of your guidance. Dear colleagues, we are joined by Excellency Dr. Mansukh Mandavia, Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizer, Government of India. It is my distinct privilege and pleasure to request the Honorable Minister to deliver his inaugural address. Sir, the floor is yours, please.
join us today. Excellency Katsunobu Kato, Honorable Health Minister, Japan's G7 Presidency, Dr. Tedros, Director General, World Health Organization, Sri S.P. Singh Baghel, and Dr. Bharti Praveen Pawar, my colleague Union Minister of State, Health and Family Welfare, Sri Abhay Thakur, India G20 Presidency, South Sherpa, Sri Love Agrawal, G20 Health Focal Point, Honorable Ministers of Troika from Indonesia and Brazil, Honorable Minister of G20 and invited countries, distinguished delegates. Namaste. It is my utmost honor to warmly welcome you all to my home state of Gujarat. The city of Gandhinagar commemorates the lasting memory of Father of Nation Mahatma Gandhi and the value of ahimsa, means non-violence, satya, truth, and sarvodaya, universal upliftment. His teaching of voluntary cooperation, dignified and peaceful coexistence has not only inspired our Indian Constitution but also driven our endeavors in G20 to collectively build one earth, one family, and one future. Excellencies, having witnessed one in a century crisis of COVID-19, we at G20 have a duty to prevent, prepare, and respond effectively to any such future crisis. Towards this, India prioritized health emergency prevention, preparedness, and response, placing emphasis on the One Health approach, recognizing that the well-being of our communities depends on the harmonious balance in the ecosystem. We have collectively agreed on a need for an end-to-end medical countermeasures coordination mechanism to timely deliver safe, quality, affordable, and effective vaccines, therapeutics, and diagnostic. Excellencies, equitable access to vaccine, therapeutics, and diagnostic should be a non-negotiable right of every individual. Joint vision of G7 and G20 on medical countermeasures is a remarkable convergence, and we as G20 continue to align with WHO process of working group on international health regulation and intergovernmental negotiating body. It remains my utmost hope that G20 can eventually facilitate the creation of permanent mechanism. Excellency, COVID-19 served as a pivotal catalyst for greater adoption of digital health in empowering patients. The fragmentation and limited intersectoral collaboration limit its potential presently. The Presidency has worked closely with WHO to establish the Global Initiative on Digital Health, WHO Managed Network. I thank all G20 members for their leadership in designing the initiative. I acknowledge the support and contributions of the Asian Development Bank, Vadwani AI, PATH, FIND, SEPI, Gates Foundation, SAFE, Foundation Bostnar, and other to GIDH. I urge all to consider aligning to the vision of GIDH and look forward to your commitment to the agenda. Also, I am delighted to state that our negotiators have completed negotiations on the text on the Health Ministerial Outcome document and have successfully concluded a discussion on all subjects bearing one geopolitical paragraphs on Ukraine. I congratulate our negotiating teams. They have burnt the midnight of 4 weeks and have reached an agreement of critical global health matters after many rounds of in-depth discussion. The text of the final Health Ministerial Outcome document has been shared with all of you today. So, with the concurrence and support of all of you, I now have the pleasure of declaring its finalization and adoption by all of us. It will be released formally to the media tomorrow. I once again thank you for your goodwill and constant support in ensuring that this collective endeavor of ours has been concluded successfully. I look forward to an effective follow-up of our agreed outcome document and its implementation in the months and years ahead. Excellencies, the challenges we face may seem diverse and different, but they stem from similar fault lines. I would like to begin today with a thought by Gandhiji. The future depends on what we do in the present. Let us seize this moment today, unite in purpose, and resolve to create a healthier future for all. Thank you. Thank you very much.
Thank you, sir, for sharing your valuable insights on the issues being deliberated in the Health Working Group. May I now request if we can have the curtain raiser video, please.
India welcomes you to the momentous G20 Health Ministers meeting in Gujarat, a land renowned for its industry, rich culture, and historical significance. Gujarat is the home of Mahatma Gandhi, the father of our nation, an apostle of peace, truth, and non-violence across the world. 8 months ago, the Health Working Group embarked on a landmark journey to deliberate upon a transformative health agenda that will go a long way in building resilient, responsive, and robust global health architecture. Prime Minister Shri Narendra Modi envisioned that India's G20 presidency should be inclusive, ambitious, decisive, and action-oriented. And we would like to thank the distinguished delegates for making this possible. So far, India has successfully conducted 3 Health Working Group meetings and side events in Kerala, Goa, and Telangana on the 3 identified Health Working Group priorities and 13 co-branded events on other focus areas such as adolescent health, food safety, non-communicable diseases, tuberculosis, and climate change and health. Now, as we meet today and tomorrow for a historic Health Ministers meeting, let us recap our priorities and deliverables. In alignment with India's G20 theme of One Earth, One Family, One Future, the working group acknowledges the initiative of Asian Development Bank towards launching of a climate and health initiative to facilitate knowledge sharing and partnerships in these 2 critical intersecting areas. while we finalize the permanent global medical countermeasures mechanism and undertake detailed deliberations in intergovernmental negotiating body, we look forward to the launch of an interim global medical countermeasures coordination mechanism progressively during the G20 ministerial meeting. The Health Working Group recognized the need to create a comprehensive ecosystem that converges efforts and investments in the digital health arena. We conceptualized and designed the global initiative on digital health. Built on 4 pillars, this WHO-managed network will converge digital health initiatives, funds, and create a repository of quality-assured digital health technologies. India acknowledges the efforts of the G20 countries, invited nations, and international organizations in shaping the health priorities and deliverables. We all need to work towards ensuring equitable, accessible, and affordable health services for all, leaving no one behind. Let us converge, consolidate, and collectively create a healthier future. One Earth, one family, one future.
Distinguished colleagues, it is my distinct privilege to now request the Honorable Ministers from Troika countries for their opening remarks. I would submit if the opening remarks may please be limited to 5 minutes each. It is my privilege once again to invite Excellency Mr. Budi Sadikin, Honorable Minister for Indonesia, to deliver his opening remarks. Excellency, the floor is yours, please.
Okay. So my apologies. Distinguished colleagues, ladies and gentlemen, when His Excellency Minister Manavia and I met a few months ago, he invited me to come to this G20 meeting held in Gujarat, his hometown. Recently, I learned that Gujarat is also the birthplace of Mahatma Gandhi, who once said, "You need not to wait to see what others do. Be the change you wish to see in the world." Today, again, the world has given the opportunity to change for a healthier future, and this opportunity extends beyond our national boundaries. In fact, as health ministers, as humankind, we indeed share one earth, one family, and one future. I believe we can collectively lead the change in global health system for a better and healthier world. Excellencies, Indonesia stands in full support of India's G20 health priority issues. First, on health emergency prevention, preparedness, and response. Indonesia deeply recognizes the interconnectivity between human, animal, and environmental health. I would like to highlight the urgent need to operationalize One Health surveillance. As ASEAN chair, Indonesia is preparing to launch our integrated One Health surveillance on top 10 animals with top 10 pathogens which have the greatest potential to jump to human, and working on potential diagnostic, vaccine, and therapeutic at the animal level, which is easier and faster to do, rather than waiting until it jumps to human. Furthermore, Indonesia also realized that climate change is changing the way human beings interact with animals and environment. Indonesia, with very large biodiversity and genomic variety, has one of the largest risks as a country for pathogen spillover, and we are very committed to prevent this. Second, the agenda of strengthening cooperation in pharmaceutical sector. It is very aligned with Indonesia's vision to ensure the availability, accessibility, and affordability of essential medical countermeasures, not only nationally but also globally. We support the effort in establishing an inter-mechanism of global medical countermeasure platform promoted during the India G20 presidency, building upon our commitment in the previous presidency into concrete actions. We would like also to re-emphasize the importance of aligning research and development to manufacturing of vaccine, therapeutic, and diagnostic tools, and to expand and diversify the capacities to G20 developing countries' capabilities, especially in research, development, and in manufacturing. Lastly, on digital health innovation and solution, I do personally believe that technology will revolutionize healthcare. However, many digital initiatives function in silo and lack of data standard, leading to fragmentation and duplications of resources. Coming from banking sector, I've seen that you can travel across the world and use your card to access your account easily and safely. We therefore welcome the establishment of global initiative on digital health to democratize digital technology, converge effort and investment in the digital health space globally. Excellencies, Gandhinagar, Gujarat, where we are meeting today, was named after and built upon Gandhi's principle. The man of peaceful action has taught us an ounce of practice is worth 1,000 words. With this spirit, let us further deliver our mission through today's and tomorrow's G20 Health Minister meeting. Let's do something quickly toward a healthier future for us and generations to come. Thank you.
Thank you, His Excellency, for highlighting that let's collectively create a healthier future. May I have now the privilege of inviting Excellency Ms. Nizia Trindade Lima, Honorable Minister of Health from Brazil, to deliver her opening remarks. Excellency, Honorable Minister, the floor is yours, please.
Thank you. Your Excellency, Dr. Mandavia, Minister of Health and Family Welfare of India, Honorable Ministers, Honorable Dr. Tedros Adhanom, Director of the WHO, distinguished delegates, Namaste. It's with great honor and joy that I join you, Mr. Mandavia, and all of our fellow ministers in this inaugural session of the G20 Health Ministers meeting as part of the Troika. I'm grateful for the generous and the heartwarming way that the Indian people and government have welcomed my delegation. I would also like to commend Dr. Mandavia for his leadership in setting the priorities for the Health Working Group, as well as to the colleagues from the Ministry of Health and Family Welfare of India for their hard work in developing the working documents and conducting all the meetings in the last month. As the Brazilian president of the G20 approaches, I would like to express my gratitude and the hope that we can, just as our Indian colleagues have done, continue to promote quality discussions on most pressing issues. This session is an evidence of how relevant this G20 Health Working Group has become over the years. I see around this table a number of the most important players in the health sector in all continents. This creates high expectations in and out of this room. That by itself deserves a reflection, because you do not replace the 194 members of the World Health Organization. We never could. But many will look up to us for leadership in addressing structural issues that harm their sanitary situation and hinder the development of their national health systems. Our highest hope is to build consensus, mobilize resources, and so help to pave the way for moving things forward in the international arena. And meetings like these are opportunities not to be missed for the advancement of global health. This is all the more relevant because the COVID-19 pandemic is falling behind us, but the unforgivable shortcoming it has highlighted in our national systems and in the international global architecture are not. Themes as equity in access to innovation like vaccines, diagnosis, and digital health to strengthen the health coverage, universal health coverage, are urgent for our progress. And it's also urgent the importance of reinforcing the capacities of the developing countries in terms of production and health progress. All the more relevant thing, I think, that we are over halfway through 2030 and is still far from achieving the Sustainable Development Goals. We need a concrete, effective boost to meet our goals, one that can be sustained in coming years, or our words will turn out to be void, to the legitimate disappointment of our peoples. So, Mr. President, it is time to work to reap our harvest. We can't forget the COVID-19 pandemic, and one of the Brazilian Minister of Health actions in this context is to build a national memorial in Rio de Janeiro, Brazil, for COVID-19 pandemic, lest it be forgotten. We look forward to today's deliberations, since they will touch on contemporary issues dear to us all. We have a chance to return home in a couple of days with meaningful outcomes. Let us seize it. We are confident in your guidance. I hope you can still reach consensus. The time to act is now. Thank you very much.
Thank you, Her Excellency, for your invigorating guidance and message to the Health Ministerial meeting. With this distinguished delegate, we would like to thank all the Honorable Excellencies, all international organizations, invited countries, and the distinguished delegates on dais for gracing this occasion for the inaugural session. And we come close to the inaugural session. Before we go to the next session, I would like to submit that we have organized a curated visit to the Health and Wellness Center, to Jan Aushadhi Center, which is a center which is known also as People's Pharmacy, where generic medicines are supplied at affordable prices to patients across the country, and also visit to the pharmaceutical sector units within the country close by. We would be urging all the distinguished delegates and other people who are also joining us through the overflow room that if they would like to visit any of these places, the visit is organized today, tomorrow, and the day after also. Please take advantage of the visit so planned. We would also like to submit that we have 3 curated exhibitions which are organized here, one on MedTech Expo in the helipad ground, and 2 exhibitions, one on traditional medicine, as well as another exhibition planned for One Earth, One Health event focusing on value-based healthcare. We would be urging all the distinguished delegates to plan your time, and if you are able to visit those locations, please. With this, I would request and thank once again for all the distinguished delegates for this inaugural session. And before we start the next session, may I request the esteemed keynote speakers of the next session to please join us at the head table for commencing of the next session in next 5 minutes. Once again, thank you very much. Thank you.